Yes, so it was an honor to be at ISLB to talk about what patients need when it comes to liquid biopsy. And, we talked about several key barriers that Lungevity is working on to improve patients' experience with this. And the first is really increasing education and awareness around liquid biopsy. And I would say that's not only for patients, but also providers, because we acknowledge that there remain significant knowledge gaps about what liquid biopsy is. So we think about the kind of who, what, when, where, and how of the education and awareness piece. And so again, I just said the who is both patients and providers. The what is really defining what liquid biopsy is. A lot of people still don't know what liquid, how does it compare to traditional tissue biopsy, for example. The when is, really educating patients around how or when it might be used. So we think about at the point of diagnosis, at the point of progression or recurrence. We talk about using it for tissue, or rather for treatment matching, for treatment monitoring, for assessing minimal residual disease. We're also beginning to see targeted therapies and lung cancer treatment move into earlier stage disease setting as well, not just advanced stage disease. So we, want to educate about that concept as well. And then we're seeing, more of these multi-cancer early detection tests come online, which, are looking to detect cancer, early signs of cancer in the blood. So we want to educate patients around that. I would say in terms of the where, we think about education and awareness opportunities on a global level and acknowledge that there remain significant gaps, around the world when it comes to educating both patients and providers on this technology. And when it comes to the how, we want to think about how are we interpreting these liquid biopsy test results? How are they being used to benefit patients, to make sure they're getting matched to appropriate treatment? So that was the first key barrier that I talked about. The second is improving access. So I gave a couple of anecdotes of just patients I've had the opportunity to work with globally. And so one was a patient in Canada who was experiencing a significant pleural effusion and was hoping to get a repeat liquid biopsy test, but her healthcare provider was declining to order it for her, saying it would not find anything. And so my colleagues and I here in the U.S. were able to assist her with getting a repeat test, but there's still issues of provider bias that I think we must address, and then that goes back to the education piece too, and making sure that guidelines are current. Guidelines are not consistent everywhere. And then in terms of some of the patients I've worked with in the UK, they indicated that many providers there aren't really aware of the potential of liquid biopsy. And so the more informed patients are kind of educating their own doctors about it and then requesting, getting access to it. So it's kind of countering some of those issues of provider bias and also increasing just general availability of the technology. And then, of course, as I said, really the elephant in the room that many of us are up against is addressing issues of cost and reimbursement. So the technology is still somewhat expensive, although we hope in time the cost will continue to come down. But then for many people, the reimbursement challenge remains significant. So here in the U.S., some providers or payers rather have indicated that they may not be willing to reimburse for concurrent testing using tissue and blood simply because turnaround time is too slow for tissue. That's not a compelling reason for many of the payers. In the UK, they're up against, even if patients can get access to the test, then they have challenges getting access to the appropriate treatment because of the regulatory landscape and how drugs are approved there. And certainly in low and middle income countries, the cost of this technology often exceeds what people may make in a year. So we have to get it to a point where it's affordable and more broadly accessible. So again, those key barriers are education and awareness, increasing access, addressing issues of cost and reimbursement.